So today we're going to be doing a virtual interview with Dr. Richard Gaines, President and CEO of LifeGaines Medical and Aesthetics. We'll be discussing the economic obstacles and safety precautions he's taken to fight the spread of COVID-19. It's been over a year since the first confirmed COVID-19 case that's appeared in the United States, and still a widespread problem that we're fighting to this day. As a highly respected doctor in South Florida, Dr. Gaines, could you tell us a little bit about yourself, your business, what LifeGaines Medical offers, and what are the benefits of being a patient at your office?
Sure. Thanks for having me, Johnny. My business is really a wellness-centered medical practice. It's evidence-based practice of basically alternative therapies for patients who want to maintain their health and longevity and their general health. What the practice is called is age management medicine. Other people call it anti-aging medicine. I'm not really against aging, so I prefer the term age management. And as we age, we lose some abilities, we lose some physiologic function, and this is all designed to bring all this back and maintain it for the duration so that you can live a productive, healthy life as you are at the age of 40 or 35 or 40. One of the things that we do specifically here at LifeGaines is monitor hormones, which are chemicals in our body which decrease as we age, and those are things like testosterone, estrogen, progesterone, cortisol. These are hormones that are very important, but they do have a tendency to drop as we age, and it's the human condition. But adding them back as they drop, you can actually decrease disease and disorders of aging, like Alzheimer's and osteoporosis and diabetes and heart disease and frailty and fractured hips. All these things can be decreased if you maintain good levels of your hormones. This is not just my opinion. It's in medical literature. It's supported in the medical literature. And everything I do in my business is evidence-based. So that's really the practice here that I have, and
Yeah.
it's fun. I have a good time with my patients. They're all well, so it's wellness practice.
Mm-hmm. Okay, so it sounds like you do, a wide variety of things at your office, and basically try and keep, everyone healthy and stay on course to live a, a healthy, well life.
Yep.
So in regards to COVID-19, with that going on and the pandemic, has this had an impact at all on your business? And
Oh yes, yeah. And
if
what else?
so, how did you cope with that? And maybe what were the, problems that, you faced?
Well, it's obvious. I mean, COVID is an international crisis that developed over the last year, and it's still here. To me, it's a natural thing that happens over time. These plagues, and this is another one that has swept through the world. Of course, early on, we had isolation and quarantine and shutdowns. So, of course, it affected everyone's business, and my business included.
Mm-hmm.
The fortunate thing is that with my business, I do a lot of telephone work. I do some audio visual, and I do use platforms like Zoom. I've used Skype for over 15 years to discuss therapies with patients and to make sure that they're doing the right thing. I mean, I can see you, and I can see that you're a healthy guy. I can determine that a lot through audiovisual contact, and I find it very, very useful. Though of course, business did decline. People coming in the door decreased because of this COVID scare. But over time, we started implementing, social distancing and cleaning and face masks and even gloves in some cases. And people gradually returned to almost what is, I consider, back to normal. It's
Yeah.
almost back to normal, and people are accepting this COVID plague now, and of course the vaccine is out, so we're all very hopeful. I'm planning to become a distribution center for the vaccine as well. I'm
Oh,
going to just
wow.
apply to do that for my patients who haven't had the opportunity to get the vaccine.
That's good to hear. Um, so with all these difficulties that, kind of brought about themselves with this pandemic, what were some of the things besides, I know you said social distancing, gloves, masks, and things like that. Was there anything else that you guys might have done within the office to try and, overcome this,
Yeah,
you know,
yeah, it's interesting you said that. I mean, I actually started using way back in December of last year a generator, an ozone generator, which has a Hepa filter as well, and basically it circulates the room air through a filter, and it sort of also has ultraviolet light. It sort of zaps the air, and we're hoping that it does work to clean the air. There is evidence that it does work. So I purchased three of these, and they're throughout my office. There's a now I know there's a one that's been designed to actually kill this COVID virus, so it's available now too. But I suspect mine works pretty well as also, and we have that here. Of course, we have face masks, and we have gel, alcohol gel for patients, and we frequently are cleaning our hands and cleaning surfaces after each patient. Um, some patients are a little lax. We try to make everybody comfortable, but as employees here, we wear face masks all the time with patients.
Mhm.
Uh, even with my employees, I encourage some social distancing, and we've been very fortunate.
That's good to hear. That's very interesting. The HEPA filter. I haven't heard of that one before. It zaps the air and kind of, makes it
Yeah,
safer.
it's something I forgot. I forgot all the details about it, but I know
Yeah.
it has an ultraviolet light, and it has of course a fan that circulates the air and exposes all the air to the ultraviolet light and to some electrical discharge, which creates some um, peroxide. That's what it is, H2O2, not
Hmm.
ozone. It's H2O2. And
Okay.
peroxide has a tendency to clean up surfaces and viruses. So all this, the H2O2, I remember now, it actually settles on the surface of all the furniture and everything. So it sort of disinfects the whole day.
Interesting. Very cool.
Yeah.
Um, so with that being said, has COVID-19 changed your priorities as a physician? Like, have you, maybe you're focused on, obviously the wellness and the health of your patients, but with this, has it changed to try and, make it have any of your priorities changed
Yeah,
along with those
I think
lines?
I think it has changed my practice a little bit. I can tell you that if you people are concerned about their immune system health now a lot, and also about their ability to fight COVID. So a lot of our therapies actually, of course, help your immune system and the ability to fight COVID. But there's now evidence that some of my therapies actually are used to prevent COVID. And without getting into too much detail, as we age, we accumulate old cells in our bodies that sometimes don't want to just die, and your immune system lets them live, and they send out bad signals to other cells in the body. So we call these are senescent cells, and you accumulate that as you age. So your senescent load increases as you age.
Mhm.
When your senescent load is high, your organ function decreases, your brain, your heart, your kidneys. So one of these proven technologies now is to get rid of these senescent cells. Some people call them zombie cells. You scrape all these zombie cells out, and your organ function improves, your brain function improves, your immune system improves, and you can actually. It's been proven now, and I just saw two studies on this, where it decreases the severity or even the incidence of COVID.
Hmm.
It's called senolytic therapy, and I've been offering it for a couple of years now, but
Yeah.
it's even more significant now. So I've really been letting my patients know about it, and we've have a lot of people interested in doing this senolytic therapy. It's very simple to do, and it's well proven to increase organ function, and we think longevity. So that's one of the things so I changed my practice a little bit, really thinking that senolytic therapy is a very, very important topic to bring up with all my patients.
Okay.
Ozone therapy, intravenous therapy, we've actually increased a little more ozone. We can deliver ozone through the intravenous when we give vitamins,
Mhm.
and this ozone kills viruses immediately.
Yeah.
So if you put it into your bloodstream, it's going to wipe out viruses, and we've been doing an awful lot of that over the last year.
That's very good. That's very good to hear. So with these changes, that you've implemented in your business, how did your patients and your customers, take that in? Were they, did they have, were they excited about it? Did they not like it very much? How was the
Yeah.
morale of the overall customers?
Well, people do. I can tell you that there's a good percentage of people who are very concerned about exposure to COVID.
Hmm.
So with these people, I do stress that their immune system health is important, and we try to address that. There are basic steps that I follow for general wellness. So there's the most important thing to me is lifestyle and getting people's hormones back where they're supposed to be,
Yeah.
because that also affects your immune system a lot. Um, uh, people are accepting that, and they actually are more motivated now
Hmm.
to improve their health. And I see that with people coming in, they're really very interested in improving their health, and they're just so they can have the ability to fight COVID
Hmm.
until they get a vaccine. Of course, there are people. I would say 50% of people don't even want a vaccine, so they want to maintain their immune system health and
Yeah.
health in general, so they can fight the exposure. And I provide services for these patients, and I happen to be one of them. I'm not crazy about the technology that these vaccines require. So I'm going to choose not to get the vaccine and just take care of my immune system, and I'm not scared of getting COVID. It's a flu. There's a low percentage of deaths, but it's something that we all have to live with. We have to move forward. We have to live our lives.
So overall, with the changes that you've done in your business, and kind of a lot of people are more inclined to do these types of intravenous therapies and different medicines to make their make them healthier. So overall, has
Mhm.
that had a positive impact for your business in the end?
You know what? I think it has, because people are definitely more um, knowledgeable, definitely more knowledgeable about what's going on. They know their immune system health is of paramount importance. They hear a lot of medical terms over the on the news all the time. So they come in here already educated. One of my big things in my practice at LifeGaines is educating patients
Hmm.
about it.
Of course.
Make sure they know what I'm planning for them, and they know the reasons why we're doing this. And I know the patients appreciate that. So by also addressing this COVID issue, they appreciate that as well, and it's been working out really well.
Okay, that's good. So me and you are obviously doing a virtual meeting here. You said you do a lot of over the phone meetings with your patients and Zoom meetings. Um, so is that something that you generally could do from home? Have you implemented any work from home or remote type positions during the pandemic?
Well, the yes, as a matter of fact, I have when we had a shutdown
Yeah.
where we couldn't have anybody in. I actually communicated with my patients just like we're doing now,
Hmm.
and of course some of my patients are technically challenged because they're in their 90s, but I have 90-year-olds that actually are very good at it. So it seems to work well. I worked from home then, but now my employees are back and everybody's back here uh,
Hmm.
uh, working, and I still do audiovisual. I have people from all over the country, actually other places in the world that I
Hmm.
do. that I practice audiovisual or telemedicine with. I was I was a member of the Telemedicine Association, American Medical Telemedicine Association for many years. 15 years ago, I first started using things like Skype.
Yeah.
One was called Voodoo. These things that were permitted this type of thing. Zoom happens to be very good. I mean, this is a real good platform, and the voice delay is very short, and it seems very user friendly. So I like Zoom. So the answer to the question is yes. We work from home. When I travel, I sometimes actually do this while I'm traveling from the hotel, and but we're here in the office also.
Okay. Awesome. Yeah, it seems, it's been super helpful that, a lot of people have been able to implement some sort of work from home or even do Google Meets and Zooms and so on. So
yeah, I meant to tell you that I have patients who are from all over the country. A lot of them moved to Florida for certain reasons, like they want to get out of New York. So they have moved out here and they work from here. Their office, their business is in New York, but they can work remotely. And they visited me. They've bought some homes here, and it's going to change a lot of things. I'm not sure what's going to happen. I don't know what's going to happen to commercial real estate, but we know that a lot of people can work from home or anywhere.
So ironically, the COVID-19 has basically allowed people to move where they've always wanted to live.
Yeah, as a matter of fact, true. I can give tons of examples, but yes, absolutely.
Okay, so with that being said, you said you're at the office now. Do you guys do any sort of COVID testing at your facility?
We do have COVID testing. We've had it from very early on. We always had the finger stick, which is the antibody test. The problem with the antibody test is, of course, it takes weeks and weeks to start developing antibodies after an illness. So it's not a very I don't want to say it's not a useful test, but it's not the primary test that should be used. The primary test is a PCR or a test that will test for antigen. In other words, it tests to see if you have any virus in your body. That makes a lot more sense. It's a lot more useful to protect other patients or other people if you know that are shedding the virus. So PCR is more valuable. It used to take 5 days to get the results. Now it's 1 day or even 12 hours. You can get it for a PCR, and it can be from saliva or it can be from just a throat swab. The other test with a finger stick and you drop some blood, that's the antibody test, which shows you have immunity to the virus, or you have had the illness
in the past. Okay.
Yeah.
And so how accurate are those tests? Let's say the finger prick to the nasal swab or the throat swab.
Yeah, well, there's a big controversies with the finger stick because they were really pushed initially when they first came out. A lot of the stuff came from China. A lot of stuff was counterfeit. So there was a lot of problems with that. So now there's a false positive range, false negative. They say that it might be accurate up to 80%. Some people think it's 60%. But that's the finger stick test or the antibody test. The PCR is more accurate, but it can have failures too. So that's about 90% as well. So these aren't foolproof tests. So if you have signs and symptoms, you should go for the PCR or look for the actual virus with the testing. And if you thought you've had the illness, a few weeks later, you can try the finger stick, which is actually an immediate result. So the accuracy of the finger stick, I would say, I'm a positive guy, so 80%, and I think 90% for the PCR.
So pretty good results. I mean, 90%, but okay.
It is. That's good.
Okay. All right. So with everything we've talked about today, are Is this pandemic going to change how you do business in the future permanently, or do you think eventually maybe you can get back to normal, or are you going to be changing how you do day-to-day business in the future because of this?
I think there is a new normal. There will be a new normal. I don't think. I hope face masks will not be around more than 6 more months. I mean, but there are going to be people who wear them. But is it going to be required? I don't think so. After herd immunity and many vaccinations, the I think we are going to be more cautious about cleaning after each patient
Mm-hmm.
and maintaining cleanliness of each surface in my business. We do procedures here, so we completely clean the room, every surface in the room after each patient. It does take extra time, but it's a good practice anyway.
Yeah, of
So,
course.
so I think it's in a way it's a good thing, and yes, I guess it will be a new normal, but a positive new normal.
Yeah. So basically hoping we can get back, eventually to where we were, but kind of also staying on pace to, stay safe and keep clean and, keep everyone else safe.
Continuously. Yeah.
Yeah.
I mean, the thing is, I can give you an example. For instance, many years ago, when AIDS was first being exposed, that was in the 1980s, 1981 actually. It was first thought you had to isolate these people, treat them. You had to cover yourself, and I was in medical residency then, so we had to cover up and
Yeah.
these patients were isolated, and it was just a very difficult problem. And then a few years later, we consider everyone possibly having AIDS. So
Mm.
you treat everyone with universal precautions, and that means you don't stick yourself with a needle that you used or anything like that. It's basically what we're practicing now is universal precautions, and
Yeah.
I think that's going to be something that is just going to be a little more formal.
Yeah.
And
Just
and
basically
I
everyone's
look
going to
forward
be
to it. It's
aware
fine.
of the next person next to them and just kind of the same scenario. Okay.
Yeah.
Well, Dr. Gaines, thank you for your time today. It's been nice talking with you today, and
Thanks, Johnny.
I really appreciate your time.
Okay. You take care.
All right, I'll
Thank
see
you.
you soon.
Okay.